Hi Susie, my name's Mackenzie. I'm going to be going over some of your lab values today and kind of telling you what they mean. So the first one we did was sodium. That should be between 135 and 145. That's to evaluate fluid, electrolytes, acid-base balances, and then any relative neuromuscular, renal, or adrenal functions. Day 1 and 2, you were within the normal values at 138 on day 1, and then a decrease to 136 on day 2. Then at day 3, you had another decrease to 134, which is slightly below the normal values. This overall decrease is due to your diuretic therapy and IV dilution, which is the IV we have you on and the Lasix medication you're taking. We're not concerned with this, but we're going to continue monitoring it. Next is your potassium. It should be between 3.5 and 5. This is to evaluate renal function, acid-base balance, neuromuscular, and endocrine functions, as well as any arrhythmias of the heart. Day 1 and 2, you were within the normal levels at 4.2 on day 1, and then a decrease to 3.8 on day 2. And then day 3, you were below the normal value with another decrease at 2.6. This overall decrease is due to your diuretic therapy and administration of the Lasix. We're kind of concerned with this, but we're most likely sure it's due to the Lasix that you're taking. It could also be something with your heart too. The next one we did was chloride, which would be between 96 and 106. This is to evaluate acid-base balance, fluids, some extracellular cation balances, and anion balances. All 3 days you were within the normal levels, being at 102 on day 1, and then 100 on day 2, and then another decrease to 98 on day 3. This just means that your acid-base balance is functioning well, and then your Lasix and your IV fluids are balancing each other out. And that means your chest pain is less likely due to be from an electrolyte issue. We're not concerned, but we're going to continue monitoring it. The next one was your CO2 or carbon dioxide levels. It should be between 35 and 45. This is to evaluate acid-base balance or any exchanges of air in the lungs. All 3 days you were below the normal lab values. Day 1 you were at 24, then a drop to 22 on day 2, and then a slight increase to 23 on day 3. But this is still an overall decrease. Respiratory muscle weakness could be a cause, some bronchial obstruction, and then damaged alveoli. We are concerned with this. It's possibly due to your smoking. Over the years, you've just damaged your lungs, the muscles, tissues, everything that play a role in it. The next is your blood urea nitrogen, or BUN. This should be between 8 and 20. This is for kidney and renal functions and to assess your overall hydration. Day 1 and 2, you were within the normal levels at 15 on day 1, and then an increase to 18 on day 2. And then day 3, you bumped up to 22, which is above the normal levels again. This overall increase is possibly due to a renal disease, some congestive heart failure, which I know you don't or aren't diagnosed with, but you do have a family history of heart issues. Your renal blood flow could be decreasing due to dehydration. We are concerned with this as it is an increased trend, but it could just be possibly due to the IV fluids. We're going to monitor your heart, see if anything changes. Next is creatinine, which should be between 0.6 and 1.2 for females. This is to evaluate kidney filtration and renal damage. Days 1 and 2, you were within the normal levels at 0.9 on day 1, and then an increase to 1.2 on day 2. Then day 3, you were at another increase of 1.4, which is now above the normal levels. This is due to a renal disease. We're kind of concerned, not too concerned, just because you are slightly above the range, but not significantly, but we're going to continue monitoring it. The next one is your glucose. Assuming that you're fasting, you're going to be at 60 to 110. This is to assess blood sugar levels and see if it's being controlled by any other treatment, which it's not. Day 1 and 2, you were within the normal levels at 105, and then an increase to 110 on day 2. And then day 3, you were now above the normal levels at 125. This overall increase, we're not really too concerned with it just because you don't have diabetes or any history of diabetes, but we're going to continue to monitor it. The next one we have is the total protein. This should be between 3.5 and 5.5. This is to evaluate any hepatic diseases, your protein deficiencies in your body, and then any stomach issues. So day 1, 2, and 3, you were above the normal level, but day 1 you started at 7, then decreased to 6.8 on day 2, and then another decrease to 6.5 on day 3. This is possibly due to your dehydration. We're kind of concerned with it just because it is dropping, and it is above the normal level. So, but since it's going down, we're concerned, not too concerned. We're going to monitor your IV fluids. Next is albumin. That is should be between 3.5 and 5.5. This is to determine liver or kidney diseases as well as protein absorption in the body. All 3 days you were within the normal levels of 4.2 on day 1, 4.0 on day 2, and then another decrease to 3.8 on day 3. We're not concerned with this. It just means your liver and kidney are functioning properly. We're going to continue monitoring it though. The next is your AST, or aspartate aminotransferase. This should be between 15 to 30. This is to evaluate any heart or hepatic diseases. Days 1 and 2, you were within the normal values at 22 on day 1, and then an increase to 30 on day 2. And then the day 3, you were up to 42, which is above the normal levels. This overall increase could be due to a pulmonary emboli, which is just possibly due to your smoking. You've damaged your lungs over the years of smoking and vaping. We are concerned with this. We're going to continue to monitor it. The next one we have is your ALT, or alanine aminotransferase. You should be between 8 and 35, and we did this test to distinguish any heart or hepatic issues and damage. You were within the normal levels on day 1 and 2 at 25 on day 1, and then an increase to 32 on day 2, and then an increase to 45 on day 3, which is now above the normal levels. So this overall increase could be liver damage from any heart attacks, which we need to look out for because it's in your family history. We're concerned with this, but we're going to continue monitoring it just because it is slightly increasing, but you're not too far over the normal range yet. The next one is alkaline phosphate. You should be between 50 and 120. This is to evaluate any skeletal disease, liver function, and then stomach enzymes. All 3 days you were above the normal level at 130, then a decrease to 128, then another decrease to 133. This is due to a biliary obstruction, hepatic congestion. We are concerned with this. We're going to monitor your heart health and liver health. This could be due to a heart-related chest pain. Your backup of blood pressure can get to the liver and damage it. Then the next one we have is total bilirubin, which is 0.1 to 1.0. This is to evaluate liver function. Day 1 and 2, you were within the normal levels at 0.6, and then an increase to 0.8. Day 3, you jumped up to 1.2, which is now above the normal levels. This is possibly due to hepatic or some liver damage. We're not too concerned since it's not too high above the normal range, but we're going to continue monitoring it. The next one is procalcitonin, which should be less than 0.05. We only took lab values for day 1, but on that day you were at 0.21, which is above the normal lab values. And the purpose we did this was to check for a bacterial infection. So this could be obviously a sign of bacterial infection in the body or some inflammation elsewhere. We're not too concerned with this. We're going to monitor it, check your white blood cell count, lactic acid, which are other tests we're coming up on. The next one we have is your CBC with differential, and that's going to entail your white blood cell count, hemoglobin, platelets, neutrophils, all of that kind of stuff. So your white blood cell count should be between 4,000 and 11,000. That's to evaluate the body's ability to fight off any infections. Day 1, you were within the normal level at 7,200, and then you jumped up to 12,500, which is now above the normal level. And then on day 3, you jumped up to 17,000, which is still above the normal level. This could be a sign of infection, some tissue necrosis due to a heart attack. We are kind of concerned with this. We're going to monitor your overall health, see how the heart of your health is, or the health of your heart is doing specifically. The next is the hemoglobin, which should be between 12 and 16 for females. This monitors your response to any therapy that you're doing, which could be diuretics, or anemia, polycythemia, anything to do with the blood. So day 1 and 2, you were within the normal levels, went from 13.5 on day 1 to 12.8 on day 2. And then you had another decrease to 11.2 on day 3, which is below the normal level. This overall decrease is a sign of fluid retention, due to the fluid from your IV or some liver disease. We are kind of concerned with it, but not too much just because it is just slightly under the normal range. We're going to continue to monitor it. Your hematocrit is it should be between 36 and 48%. This is to diagnose any blood issues or hydration levels. 1 and 2, you were within the normal levels at 40.2, and then day 2, you were at 38. And then day 3, you dropped again to 35.5, which is now below the normal levels. This is due to hemodilution, which the blood just dilutes due to fluid overload, could be from your IVs. We're not too concerned with this just because you are 0.5% below the normal range, but we're going to continue to monitor it. Next, you have their platelets, which should be between 140,000 and 400,000. This just evaluates your platelet production in the blood. Day 1 and 2, you were within the normal levels at 150,000, and then an increase to 288,000. And then day 3, you jumped again to 410,000, which is now above the normal levels. This is a sign of an infection or an inflammatory disorder within the body. We are slightly concerned. We're going to monitor your overall health, check some other testing as well. Next, we have the neutrophils, which is your body's first response to anything that comes in. You should be between 45 and 37%, and this is to determine an infection or inflammation in the body. Day 1, you were within the normal level at 60, then jumped to 75 on day 2, and then 78 on day 3, which 72 and 78 are both above the normal levels. This is a sign of infection and ischemic necrosis due to a heart attack, a stress response, maybe from work, anything that you've been sick with, stressed with. And then we are slightly concerned with this, but not too bad just because you are slightly above. We're going to monitor your overall health. Next, we have your lymphocytes, which should be between 20 and 40%. This is to determine infection and inflammation. You were within the normal levels on day 1 at 30, then dropped to 18 on day 2, which is now below the normal levels, and then you dropped to 15 on day 3, which is below the normal levels as well. This could be a heart and kidney failure. We are concerned with this, but we're going to continue to monitor it, check some other labs as well to go with it. Then you have your monocytes, which should be between 2 and 8%. This is for infection and inflammation again. All 3 days you were within the normal lab values at 8, 6, and then 5. This means there's no active inflammation in the body and you're less likely to have an infection. We are going to monitor some of your other labs such as troponin and EKG reading if it continues to drop. Then next you have your eosinophils, which is between 0 and 4%. This is for infection and inflammation again. You were normal within all of the lab ranges again on day 1, 2, and 3 at 2, 1, and then 1. This is no allergic or parasitic illnesses in the body. We're not concerned with this, but we're going to continue to monitor it. And then you have basophils, which should be 0 to 4%. We're going to check for inflammation and infection in the body. You were at 0.5 for all 3 days, which is within the normal lab ranges. This rules out another form of infection, some inflammation, and then allergic reactions as well. And we're not concerned, but we're going to continue to monitor it. Then you have your lactic acid, which should be between 0.5 and 2.2. This detects oxygen levels in the tissue and evaluates any sepsis or infection in the body. You were within the normal lab value ranges on day 1 and 2 at 1.5, and then you dropped to 1.4 on day 2. And then day 3, you dropped to 0.03, which is below the normal value. This is possibly due to not having enough oxygen getting to the tissues. We are kind of concerned with this, not too much, just because you are slightly below, but we're going to continue monitoring it, check your lung health just to see how things are looking. Then next is your D-dimer, which is should be below 250. This is to diagnose any abnormal clotting in the body. We got labs for day 1 and 3, which you were above the normal levels on both of those days, 1 being 300 and then 3 being 260, 620. This overall increase is pulmonary embolism, arterial or venous thrombosis, which could just be a lung issue or a blood clot getting to the lung or in the veins or arteries. We are concerned with this. We're going to monitor the clotting status and then watch for any blood clots elsewhere in the body. Next, we have your thyroid stimulating hormone, which should be between 0 to 15. This is going to kind of confirm or rule out any hypothyroidism or low thyroid. You were within the normal level ranges, being 2.3 on day 1, an increase to 2.8 on day 2, and then another increase to 3.1 on day 3. We're not really concerned with this. It means your thyroid gland is working well and is handling your metabolism good. We're going to monitor any resistance in your veins or arteries and just kind of address to see if there's any hyperlipidemia or any buildup of anything in the vessels. Then the next one we have is your thyroxine, or T4. This is, or should be, between 5.4 to 11.5. This is to evaluate your thyroid function and nutritional efficacy. You were below the normal level all 3 days at 1.1, then a drop to 0.9, then another drop to 0.7. This is a sign of low thyroid. Thyroid gland failure means there's an increased workload on the heart, kind of stiffening your arteries. We are concerned. We're going to monitor it with some EKG imaging, track your fluid intake, since your hypothyroidism does create an interstitial fluid buildup, which means your body just swells in places that it shouldn't, like in the cells. Next, we have your calcium scoring, which should be 0. This detects coronary artery diseases, or anything wrong with your heart, like an issue or a history of a heart attack or your risk of heart attack in the future. All 3 days, you were above the normal level at 150 all 3 days. This means that calcium or some plaque was built up in the heart arteries. This could be to smoking and just maybe a lack of exercise. This is concerning. We're going to continue to monitor it, maybe some lifestyle changes, but this does mean you're at a higher risk for having a heart attack. Next, you have your troponin 1, which should be less than 0.35. This is to detect and diagnose any heart attacks or chest pain related issues. Day 1, you were within the normal value at 0.12, and then within the normal lab value ranges again, but it jumped to 0.35 on day 2. And then day 3, you were at 0.5, which is now above the normal levels. This is possibly due to a cardiac injury or heart attack, and this is very concerning. We're going to monitor it, maybe do more testing with an EKG later. And then your BNP is the last one we did, which is a B-type natriuretic peptide. You should be less than 100. This is to diagnose and determine severity of any heart failure or issues, damages you've had. We only have labs for day 1, and you were above the normal level on that lab at 842. So that's very significantly above. That is a sign of heart failure. So the worse your lab increases, the higher it goes up. That means the worse the injury in the heart. We're going to monitor your airways and oxygenation, make sure you're getting everything you need, check your potassium levels, kidney functions, things like that. This is very concerning, so we're going to continue to monitor it, make sure nothing else comes out of it. But do you have any questions or need any clarification on anything? Okay, thank you. If you need anything, let me know.